It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
Exactly right, Candace. Like our first doctor, world-renowned doctor, Dr. Clay Cockerell.
Well, psoriasis is a fairly common disease. We see a lot of that in our practices, and probably a good way to think of it is normally it takes your skin about 6 weeks to grow from the very bottom layer all the way to the top layer. In psoriasis, that's accelerated up to about 2 days. So your skin is just growing much more rapidly than it should, and it's causing a lot of scale to develop, and it's associated with redness and a rash that you see. But it's mainly just the skin is really growing far too rapidly. Psoriasis can affect people at any age, but it tends to be more common in adults. Most people we see that develop psoriasis are probably in their 20s, teens, sometimes a little bit older. And it just kind of comes out of the middle of nowhere. Sometimes people can be under stress and can develop. Sometimes people can get an infection, like a sore throat, and they'll get what's called guttate psoriasis. You get a widespread eruption of lesions that develop, and usually that kind of goes away after a relatively short period of time. Most cases of psoriasis do tend to run in families. There tends to be a genetic relationship to it. So someone in your family tree probably had psoriasis somewhere along the way if you get it. Just like atopic dermatitis can be worsened by bacterial infections like staph and strep and things of that nature, psoriasis can too in some cases. And for that reason, in addition to using some of the things like the creams that we use to kind of slow down the growth of the skin, sometimes we use things targeted to try to get rid of underlying bacterial infections. So we'll even recommend bleach-containing washes in some cases, even for psoriasis patients, even though we don't think that's actually directly affecting the psoriasis. If they've got a bacterial infection that's making it worse, you get that better, the psoriasis will get better too sometimes. You do have it for your whole life, but the good news is there are treatments that can put it into remission, and some people go into long-term remission. They may have psoriasis that's really bad for a number of years. With good treatment, it may just go away, and then you can taper the treatment off, and it doesn't seem to come back for long, long periods of time. So it sort of behaves in different ways in different people, and we never really know for sure what it's going to do until we actually treat the person and get them into remission.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
All of the doctors here at the Best Docs Network are dedicated to changing people's lives. Like our next team of doctors, it's podiatrist Dr. Holcombe and Dr. Williams.
We're very excited about having the MLS laser treatment in our office. It's a class 4 laser. It's one of the strongest lasers, non-invasive lasers on the market. What makes this laser unique is it has a dual wavelength system in it.
I began experiencing severe burning on the inside part of my ankle. The bottom of my feet were burning to where it felt like I was walking on hot coals, and I could not walk at a normal pace.
Basically, what makes this laser unique is it has a dual wavelength system in it. What it's doing is it's penetrating through the damaged tissue, and it is triggering a metabolic reaction on a cellular level, which promotes healing.
I just wanted to be able to walk down the street and not feel pain.
Jamie has experienced pain for years. She had a chronic tarsal tunnel syndrome in conjunction with chronic plantar fasciitis. We had done surgery on one of her feet a couple of years ago, and she had reduction in pain but not complete relief of her symptoms.
Dr. Holcombe came to me and said, we're going to get this laser therapy, and I really want to try it on you. So I was gung-ho for it. I said, why not? It's been over 4 years that I've been dealing with this. I'm 2 surgeries. I'm ready to try anything.
The laser technology is truly revolutionary. It's like a magic wand that all physicians wish they had.
After the first therapy, I could tell a difference. I was able to walk across the room and I wasn't limping.
If you have a technology that is non-invasive and has no side effects, no downtime, and it can help prevent you from having surgery or reduce chronic pain, or even eliminate or reduce your medication, why not try it?
I recommend Dr. Holcombe to everybody I know, and I am always telling them to come see Dr. Holcombe. I would recommend this office to anybody that was dealing with any kind of foot pain. They have been phenomenal for me, and I'm forever grateful.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
I woke up on a Sunday morning and I had this awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me. They gave me CAT scans, and when she told me that she saw a mass in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself to Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day we wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.
There are certain symptoms we have as human beings that can alert us to diseases that can be a problem. This may be very early in the disease process, so it'd be good to catch it at that time. For example, unexplained weight loss. That's a real danger sign. Weight should not just peel off for no reason. If it does, you need some tests to find out why. Night sweats, that's a real important symptom. Now, this isn't just where you get hot because it's a hot night out or you have too many covers on. This is when you just get drenched at night on a regular basis, say more than 10 or 12 nights a month. If that's happening, that is really a sign that there may be diseases going on, all kinds of diseases. You need to get a checkup for that. Headaches that wake you up in the middle of the night, those are bad. You should not be awakened by a headache. Also, a severe headache, a severe and sudden headache, or a change in the pattern of the headache that you usually get, that's another danger signal. Change in your bowel habits, bleeding in your urine, blood in your stools, those are problematic symptoms. Also, if you have a cough that won't go away, now a cough that's just with allergies, that's one thing. But if you have a cough that goes on and on and on, let's say over 4 weeks, you probably need to have that checked, especially if you're a smoker. Now, the main thing though is to think about unexplained weight loss, night sweats that are more than just a little warm and a little hot, and just any symptom that seems to be out of the ordinary, an abdominal pain that you didn't used to have, a headache that's changed its nature. Check on those things and ask your doctor if there's any question.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
I had 2 children in the last 4 years, which is wonderful. I wanted to, get back to my normal shape, and I, started looking into getting lipo and things like that, and so I found Dr. Wilcox.
Well, liposuction is still one of the most popular cosmetic procedures done nationwide, as well as in our own practice. My preferred technique is ultrasonic liposuction, and that has proven the test of time. It's been present for about almost 15 years. Rather than just literally ripping the fat out, the cannula or wand is made of titanium. It's about this length. It has a hollow bore down the middle for suction. The tip of it vibrates over 20,000 times a second, and that's how it gets its name, ultrasound. And so we can just go back and forth gently until we can get about 2/3 of the thickness of the fat removed.
So I came in, told Dr. Wilcox that I would like to slim down around the hips, look at some areas of the stomach where the fat wasn't coming off. So he explained to me, he showed me what all he could do and what the result would look like. I was pleased with what his expectations were.
First of all, during the consultation, I make clear to them the best thing about coming to our practice is they're going to get the straight story. There are many patients every week who come in where I explain you know, I don't think the surgery's for you. We may be able to offer a non-operative measure, or maybe they just need the encouragement to realize they don't have the problem that they perceive in the mirror. In Victoria's case, she came in requesting the breast enhancement and liposuction, so we looked at her and looked at the common areas that are usually done. And she has a nice figure and she was close to her ideal weight, but she had enough fat on her hips and abdomen that we could help her with that and make a significant difference.
I'm extremely happy with the results. They've exceeded my expectations as well as my husband's expectations. It is a quick recovery for such a big result that you get. It's just very exhilarating because I just have me back.
Don't forget, for more information on any of these outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com.
That's right, we're going to head to our next best doctor. It's pain management specialist, Dr. Cesar Duclair.
My experience has been a 12-year journey. I've had 13 ESIs, which are epidural steroid injections. I've had an L5-S1 disc replacement, and it just never seemed to help with the pain that was radiating down my left leg. It even caused where I would trip and fall. I had a lot of problems with helping out with my kids, lifting my kids, being a mom.
It was decreasing her ability to work, decreasing her ability to socialize with friends and family. She had started to not be able to do the mundane tasks of life.
Dr. Duclair had asked me, well, what do you think about this device? And he kind of shows it to me. I said, well, what is that?
A lot of patients will qualify for a device, what we call a spinal cord stimulator. And that is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. And that is a great way for patients who have had surgery and are dissatisfied, or they've had injections and medications and they're still dissatisfied. Those patients can get really great relief, and they can ultimately decrease their pain for a long period of time, on the order of years, and then decrease their office visits with their doctor and become very, very satisfied and very happy with that.
I have a little remote control device. I can turn it up, I can turn it down. I like the fact that I'm in control of it. I have pain freedom now because of the device.
Amy did really, really well. She has total pain freedom. She does not see me anymore in the office because she does not need to. She's not taking any medications. She essentially has no more complaints of back or leg pain.
I'm just very blessed, very, very blessed that he's in my life, because without him, I don't know that I would have the pain freedom that I have today. So I believe that God puts people in your life for a reason.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Breast reduction is a very common procedure in the United States. The reason being is that there are many women in the United States whose breasts are larger than they should be due to hormonal responses in their body. And when the breasts get that large, it starts to become quite a problem for them on many fronts.
Ever since I was a kid, I knew I had big boobs. Initially, I thought it was very enhancing and I loved it, but then whenever a D got to an E, when an E got to F, when an F got to Triple H, and I was like, you got to be kidding me. Prior to having my breast reduction surgery, I had a very hard time walking around. Running was like next to impossible without actually being excruciating pain and feeling like I need to sit down.
Jennifer was one of the first patients that I saw here after I came to the area. She's a very nice girl who had a very common problem of having extremely large breasts, so large in fact that it really affected her daily life. She had almost constant pain in her neck and her shoulders. She found it very difficult to find clothes that would fit her appropriately, and she certainly couldn't do any type of exertional activities because of her very large breasts. I saw her here in the office. I found that she was an excellent candidate for a breast reduction procedure. We scheduled her procedure and we did her surgery. She was able to go home that same day. She did very well in recovery, and now she can do her daily activities without these constant feelings of pain around her neck and her shoulders. And I think that her quality of life has been improved quite dramatically by this procedure.
I have been able to be an active participant in my son's life. I'm able to go and join my friends out and actually not want to sit down every 2 or 3 minutes. It's unbelievable to think that a breast reduction can actually help you regain a sense of life, but Dr. Hermann helped give that to me.
Don't forget, for more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. Right now, it's time to head to our next best doctors, Dr. George Farhat.
Well, in going to my regular MD, I was getting chronic headaches, and we couldn't make them go away, and we wanted to lessen that pain, and obviously not have that. It was hard to focus, hard to concentrate at work, and as a salesman and a general manager in business, one of the things that I wanted to do was be able to focus and pay attention to my customers and to my business associates. We came to Dr. Farhat so that he could look at all of the things that were going on in my body.
Degenerative disc disease and arthritis are a common reason behind low back pain. I've known Paul for almost 10 years now. Paul is an active man, he played sports, he's an avid golfer, he golfs all the time. When I saw him initially, he had pain in his lower back and down his leg. And there's something special about Paul. He doesn't like to take medications at all for his conditions. He wants to come in, he wants to be treated, get well, and move on with his life.
When I came to Dr. Farhat, one of the things that we wanted to accomplish was how do we reduce the pain, but not necessarily have surgery or a long recovery process. So one of the things that we talked about is the injection process that we've been going on since I've been seeing the doctor for almost 10 years now.
What I've been doing for him over the past 9-10 years or so, every time he gets a major flare-up, we'll set him up for a simple procedure called epidural steroid injection in the lower back. And usually he gets several months, sometimes a couple of years of relief after the procedure. He'll go back doing whatever he was doing before, and when his pain flares up, it becomes intense, he'll call us back, he'll come to the office, and we'll go back and do the same routine on him. I can say that we were able to help Paul achieve his pain freedom so he can go back to the same activity level he always has and go back playing golf and doing whatever he likes to do in life.
Dr. Farhat, to me personally, has become a friend as well as a physical consultant to my body. He shows by his demonstration of actions how he cares about Paul Williams and who I am, what I do, and how I feel. And it's given me something that's very key to my life and the quality of my life.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
Growing up, horses were a big part of my life. I rode every day, several horses a day, and competed through high school. The main problem I was having in my low back was that the discs were degenerating, and I was told it was common in 60-year-olds, not in 30-year-olds. I had some tears that were leaking fluid and was having pain and discomfort down my legs that was keeping it where I couldn't sleep and was just in chronic pain. Did therapy for my back but still had issues. Slowly things started to go, like riding the bicycles or certain chores around the house.
I generally tell people that surgery is the last thing that we want to do. If the pain is so severe that it starts to interfere with your life, your hobby, your friends, your work, then it might be something that you should consider. If you're in that situation where you have to come home and spend your life dealing with the pain, then surgery is probably something that's a consideration if you've failed all the other conservative treatments.
Being that I live in Kansas City, I was from the Dallas-Fort Worth area. I had seen a few doctors in Kansas City and not really gotten any definitive way to get relief. After seeing the Best Docs episodes and watching Dr. Myles, I decided that he would be a good person to contact, and he was willing to look at my information and tell me if he saw anything. And he did see several things that my doctor in Kansas City did not see.
Generally with the surgery process, our goal is to decrease your pain, and our main goal is to get rid of your pain. So that's what we're trying to do when we offer you the surgery, is to get you back to living your life the way you were beforehand with pain freedom.
When I heard other patients talk about achieving pain freedom and that was Dr. Myles' goal, it sounded like a nice idea, but I didn't really think it was possible for me. It's been 3 months since the procedure, and I feel better than I can remember feeling. I thought I would be able to return to riding in January, but now he has told me I can move that up to next month. I'm very excited what he's been able to give me and really have given me what he promised, which was pain freedom.
Atrial fibrillation, a commonly known arrhythmia that involves the upper chambers of the heart becoming irregular and beating sometimes wildly out of control, sometimes beating very slow and causing the need for a permanent pacemaker. Atrial fibrillation is another risk for stroke, and therefore patients who have atrial fibrillation really need to see their doctors, be evaluated, and get on anticoagulant therapy just to protect them from stroke. Now, what causes atrial fibrillation? That's a question that many of my patients ask. Doc, why am I having this problem? And I say, well, the electricity of the heart can change over time. Sometimes as we age, our cardiac cells can change their electrical impulses, and things can kind of go haywire. So we want to make sure that we look at an EKG each time the patient comes in. It's important to check those things and ask your doctor to do an EKG if you haven't had one. If you have palpitations, if you have shortness of breath, feeling faint, make sure you have your rhythm evaluated with an event monitor or some type of Holter monitor. It's very important. Atrial fibrillation is something easily treated. Protect yourself. Get your heart checked today.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are changing people's lives.
And for more information on any of these outstanding doctors, head to the website, bestdocsnetwork.com.
And as always, if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.